Good morning. I'm here to introduce our next session. They are here to present information on special needs emergency preparedness. So our first speaker is going to be Joe Driver, and he's a public information officer and a public relations officer at Westlake Fire Department, as well as a fire captain. We also have Traci Gonzales, who's a pediatric nurse practitioner at a complex care clinic at Texas Children's Hospital. And we also have Krystal Vann. She's an AEMT and a firefighter with the Westlake Fire Department. Welcome.
Is there a clicker thing? No? Is there a clicker? Is there? This is the clicker?
Green is next.
All right. All right. Good morning, everybody. Like Miss Amber said, my name is Joe Driver. Excuse me. I'm a captain at the Westlake Fire Department, and our presentation is Are You Go Bag Ready? Disclosures. The authors, we have no financial or other disclosures or conflicts of interest to receive or resolve, sorry. Today's objectives, we're going to talk about what is an emergency, preparations to plan for an emergency, discussions on components of managing emergency situations, and post-emergency recovery.
All right, good afternoon, everybody. So we're going to start with what is an emergency. How many of you guys have had to call 911 before? Okay. And can I just ask someone to tell me, if you're willing and you're comfortable to share, like, why did you decide I'm going to call? Go ahead, sir in the purple. So I guess a better question is without influence in relation to a situation with your child. Yes, sir. So, right. So, and that's, I guess, the point that I'm going to get at. Like, recognizing when it's an emergency situation and then being in an emergency situation can be very stressful. It's stressful for every individual that's going through it, but especially for the person that is in need of medical intervention and help. And so recognizing that situation is a big part of what you guys will do as caregivers for children, but also for anyone in your life. And so this is specific to NBIA as well as children with different special needs and different backgrounds, but just in general, what an emergency is. And so it's an acute injury or illness that poses an immediate threat to a person's life or long-term health, okay? So examples: seizure activity, severe dehydration could be an emergency, changes in level of consciousness, okay? What does that mean? So someone's not coherent, they don't know where they are. There's A&O questions that we will actually ask, alert and oriented questions that we will actually ask as soon as we get to a scene to establish how oriented and alert somebody is. So a change in that. For us, we know exactly what we're asking. For you guys, what does that mean when you're talking about your child, okay, or someone in your family? It's something that's out of the ordinary for their behavior. Can be something that simple, okay? Difficulty breathing is always an emergency situation. To break it down and simplify it, we use the acronym ABCs. Airway, okay, is there something in their airway? Is there something blocking their airway? Can they not actually ventilate and perfuse and get any kind of oxygen to their body, to their organs? Can they not breathe? B is breathing, second part, and then circulation. So are they actually having perfusion? Is there blue around their fingers? Is there blue around their lips? Are they bleeding? Those are simple and immediate ways that you can say, okay, this is an emergency situation, okay? It's a little bit different if your child or the person that you're working with does not have language skills, if there's any speech deficits, things like that. So you have to be very acutely aware of, oh, okay, there's something going on here. Maybe it's something as simple as a noise coming from their upper airway. Maybe it's drooling. Maybe it's their fingertips are blue. These are examples of what an emergency is. But with all of that being said, trust your gut, okay? You'll recognize what is normal and what is not normal, what is typical and what is atypical. And I'll tell you right now, if you call and it's not a situation where we need to, lights and sirens, rush to the hospital, we do not care. We just want to be there and make sure that your child and you guys are all safe, better safe, right? So just call, okay? And so I kind of already went over the recognition piece, but here are some other key points. Trusting your instincts, monitoring for those change. So what is normal, and then why did you decide to call is always going to be a question that we will ask when we get on a scene, okay? We will say, so maybe this isn't normal, maybe they've had a fever for a day or two, but why did you decide now to call us? What's the difference that made it a situation where you were like, I'm very uncomfortable, I'm nervous, I need someone else's medical opinion involved? And then obviously that work of breathing, there's ABCs, and then there's also decrease in urine. That can be another indicator. All right.
This one? Yeah. Okay, and I'm going to talk a little bit about kind of the preparation and kind of going through it. I've been taking care of children with complex medical needs for about the last 11 to 12 years. And so a lot of what we talk about regularly in our visits and what I'm going to talk about today are both things that we've experienced, and a lot of it is honestly things I've learned from families too. And so I'm going to hopefully share some of their wisdom with you guys too. So we talk a lot about preparation, and today we're focusing kind of like on an acute medical emergency. This also overlies to like disaster planning. We have a lot of hurricanes in the South. There's tornadoes in other places, there's floods, things like that. So all of this type of preparation goes into those kinds of emergencies as well. One of the things we need to consider is transportation. Like we said, if it's an emergency and if there's question, trust that gut and what you think. Call 911 if there's any question. Absolutely. If not, then you've got to consider, do you have reliable transportation to the hospital? Can your car make it? Can a family member pick you up? Kind of that kind of thing. But you want to have a plan. We don't want to be kind of in that moment and not really know how to get there. Honestly, if you get to that moment, like she said, you can still call EMS and they will help you get there if you need to get there. Sometimes we do that way. Childcare for other children is also important. A lot of COVID restrictions have lifted and they're letting siblings in ERs and things now. But it's not ideal for parents or for the children who are there with the sick sibling. So if possible, you want to have a prearranged somebody that's on call that you can just say, call them at any time of the day and say, hey, this is going on, can I bring you the kids, or can you come get the kids? One of the things that we think about is information being available if a parent is not available. And this actually I learned more from my families. Think of things like at school. If there's an emergency, if your child's going to school and there's an emergency and they're traveling by EMS or with an ambulance crew to the ER, you're not at the bedside, right? And hopefully the school nurse is going to know some things, but we want the school nurse to know a lot of things, which is what we're going to talk about. But we always want to think about the scenarios, or worst case scenario, if there is a car wreck and a parent's unable to give information for the child. We want to make sure that that child is taken care of. Ways we can do that are, there are medical forms, which we're going to talk about. I'm going to show you an example in just a minute. The biggest thing is when we're doing these medical forms with kids' information on it, is we want it to be concise. One of my families came one time, and her thing was like 30 pages long. And as a provider, I appreciate that. Give me all the information. I want to know the entire story. If it's an emergency, we want bullet point, like this. So it's really easy for those first responders or in the ER to kind of see it and get to the most important diagnoses, medications, surgeries, those kinds of things. There's also out there's different companies, so I'm not going to name a specific one. I don't know if anyone's seen the QR codes that they make the medical alert bands with QR codes. And they're used a lot in autism when children who wander and things like that, but they can be used for other medical conditions as well. And you can be on a bracelet, just like the medical alert bracelet. They sell them in patches that can go in backpacks, diaper bags, things like that. So someone can scan that and it will take them to information about the child. Again, you can put their most pertinent medical information, but also contact emergency people that they can call to reach, who will know information about the child. We always talk about bringing extra supplies. I don't know how many of you are from the Houston area or how many of you traveled here, but anytime you travel, if you haven't already experienced, you don't want to run out of supplies. Because if you're on a special formula or you need a G-tube or something, it's not always easy to get if you're not home. Not all hospitals, if you're in a smaller town, not all hospitals have G-tubes. And so, you know, there's lots of things. If your kid's on a special formula or a special diet, you may not be able to run to Walmart and get that. So you always want to make sure you have plenty of supplies. And then kind of the plan for school is the same thing. Get to know, if your kids are going to school, get to know the school nurse. They're going to be your eyes and your ears when you're not there with your child. And so I like for them to have a form on hand as well, you know, that they have all that important medical information that they can help that child. Go bag. Have any of y'all's medical providers or anyone ever talked to you about having like a go bag ready? We love go bags. Go bags are important. One of the things that I say is probably the most important is have a list on top of your bag, wherever it is, of everything that needs to be added to your bag. I'm a planner. I even did this when I was pregnant because I was terrified I'd go into labor and my husband wouldn't know what to put in my overnight bag. So I had an entire list of everything he had to add. Because things like medications, insurance pays for a month's supply, right? So you can't have a whole supply in your go bag and a whole supply at your bedside or wherever you keep your medicine. So on your lists, no, I'm going to need to add in their medications. I'm going to need to add in their formula, their feeding pump, whatever it is that you need to take care of them that we'll need to add to that bag. The benefit of having a list is also, if it is an emergency and you're there with your child, you're probably not going to want to leave their side, right? So another parent or an older sibling or someone else can take that list and put all of those things in the bag for you so it's ready to go. I do like to have information forms, typically a folder with you can put medical information forms. This is mostly in case you end up in a hospital that is not familiar with your child. Hopefully you'll end up in the location where they receive their care and they have their records and that type of thing. Sometimes that doesn't happen that way. And so having these forms that you can give to a provider is very, very helpful in those emergency situations. We ran into that a lot during hurricane evacuations, and they would end up in other children's hospitals, you know, without any kind of records, and so they're very helpful in that situation. Of course, diapers and wipes, we all know you gotta have diapers and wipes. Change of clothes, because kids have accidents. Keep in mind, if we're going to a hospital situation, keep in mind clothes that are accessible, meaning maybe short sleeves. If I had this long sleeve and we needed to start an IV, it'd be really hard, right? But if they're in short sleeves, often we can, depending on what's going on, they can stay in the clothes they're comfortable in as long as we kind of have access to start different medications. And a comfort item. And I think most parents know this, but I just want to highlight the importance of it. Have something that makes them happy, whether it's a blanket, a stuffed animal, it's an iPad. We hear a lot of Coco Melon these days. And there's a lady, Miss Somebody, who sings. We hear a lot of, Miss Rachel, yes, we hear a lot of her. But, you know, I go into a room to check a child out. They don't want me to listen. That's okay, I understand. But we put on Coco Melon, and all of a sudden I can do all of the things. So those types of things are really important because the hospital's scary, right? Or an emergency in general is scary. If it's an evacuation for a storm, it's scary. It's stress on a child. So having something that's familiar to them is important. Now, the medication form. So this is a list of the things, but what I want to actually do is just show you an example. Now, the example I'm going to show, this was formulated a little while back by American Academy of Pediatrics and the American College of Emergency Physicians. You do not have to use this exact form. For a while, we were pushing this because then if you went to a hospital, we had all seen this form, so we knew exactly where to look for information. If you want to make your own form, that's fine, but this is a lot of the information you want to include. Include their primary care providers, contact information, their specialist, include their important or their most critical diagnosis, I should say. If somebody who did not know your child was seeing them in an emergency and they needed to act quickly, what is the most important thing that they know? We may not need to know every single hospitalization or every single procedure they've ever had, but we need to know if they have that baclofen pump or a VNS or those types of things. We need to know that. A list of their medications is also very important because if we're going to give meds, we need to make sure nothing's interacting. And then I think it's on there. One of the things that I like to put a lot to is the most common reason your child gets sick and what helps it, right? Because what I've learned with the kids that I've taken care of for many years is we kind of know if we intervene early on, we kind of know they get this cold, this is how they do, we intervene early with this, and often we can avoid things getting worse. Or kids who have things like tracheostomies, we know they grow this certain bacteria, so they're gonna need this specific antibiotic. And if you have that type of information on there, then hopefully they can kind of start along the correct lines of treatment early on. And then just like anything else, you want to practice. Nobody wants to be in an emergency and they're stressful. Some people are great in emergencies and that's when their adrenaline kicks in and they're calm, and some people aren't, and that's okay. But that's what we want to plan, so that when that time comes, you're ready to go, you know where all of your things are, you have those forms. On those forms, the other thing would be make sure we update those. Usually annually check on them, but also if there's a big life event, if you had that backflip and pump placed, then you want to update those forms. In my mind, that is one of the benefits of that QR code type, because you update one place and it's for everywhere. Whereas if you have forms at grandma's house and at the school and in your go bag, you just have to make sure that you update every form.
All right, so now let's talk about from the EMS perspective, what happens when we get there. So you recognize it's an emergency, you call us out, and so I'm gonna run through kind of our line of thinking when we first initially come on scene. But pre-arrival, pertinent information that's really helpful for us to know is, what is your child's sensitivity? So do they have auditory sensitivities? Do they like just maybe too many people being around them? Is that overstimulating for them? Is touch something that's overstimulating for them? What can trigger your child and make the situation more stressful for them and for you as a parent working with your child, and make it more difficult for us to perform any kind of necessary interventions? Because we can do things like actually speak with dispatch. We can go through and notify them and put a note on your address and on your home that says, please turn off the sirens before you arrive, okay? And if that's something that we can do to help ease the stress for your child and for you, we want to go ahead and do that and know that coming in, okay? So sensitivities, sensory issues, and anything else specific that would be just pertinent for us to know. Again, trust your gut. So why are you calling and telling us right away, what is the reason that you feel that we need to be here? How can we help you? And what's your chief complaint? Your chief complaint is going to be the reason you're calling, okay? So the biggest issues. There might be several things going on at the same time for your child. Again, we have lots of different children with lots of different backgrounds, different levels, and different needs. What is the most primary concern for you as a parent and your child in that moment? So that way we can address that first and then follow up with the other coexisting concerns that you might have. And then we run through what's called a sample. It's an acronym for us that helps us go through all of the different pieces of assessing your child. So S is for signs and symptoms. What are the signs and what are the symptoms, okay? What are the things that externally that we can see, and then what are some symptoms that your child might be having, okay? Allergies, do they have any allergies? M, medications, what are they currently taking? That is all so important, and Traci already talked about having that list. If you guys already have that list made out, you can just hand it over to us. It's like a face sheet at a hospital. It is such vital information to us because, again, a scene is very stressful. You're the parent, you're trying to navigate that situation, communicate with us, help ease the stress and the trauma for your child while they're going through the situation, make them feel more comfortable, and give us information at the same time. If you can have other caregivers or people that help with taking care of your child, they're present, so that way you can navigate it, because there are going to be multiple questions being asked. There's going to always be more than one provider there. When I come in on the ambulance, there's at least 2 of us. And sometimes, if we need to, we'll bring in the fire side, which Joe will also talk about a little bit in a second. And so there can be multiple providers. Again, we need to know how much personnel we need depending on the circumstance and the situation. But it's a lot going on. It can be very overstimulating, not just for your child, but for you as a parent or as someone caring for a child. Pertinent medical history. So again, Traci mentioned this a little bit, but just things that are absolute for us to know. Has this ever happened before is always a big question that we want to know. Because if it's happened in the past, then we understand what the trajectory of how that plan may go for that child, and we can try and catch it early off in an intervention. Last oral intake, when's the last time they ate, so that way we know if they go into a situation where they need surgery, we can share that information with the hospital personnel, as well as if they are, if they have a menstrual cycle, when was their last menstrual cycle? Things like that are important for us to know. And then events leading up to it. So what happened for, again, you guys to decide this is a situation where I need someone else to come in and assess an emergency? okay? What are the events? We've had kids where they wandered off, they got hurt, they're not sure exactly what the events were that led up to it. That's okay. Just let us know. We just want to make sure that we have all the information because it can help us weed things out, whether it's trauma or if it's a medical call, and we're going to treat those things differently. If we don't have that information up front, we have to go through a list and kind of weed out what the information is that could be causing the signs and symptoms that we're seeing in your child. And then OPQRST is going to be for each sign and symptom that you give us. So it's the onset. So when did it start? The provocation. So what makes this symptom worse or better for your child? Is there something going on that exasperates it? So if they move around, are they having more issues? Quality. And so if the patient can't describe or if your child can't describe it, ideally that would be something that we would want to know, like what does it feel like? Can you describe the pain? Things like that. Maybe they can't do that. Maybe they're not verbal. That's okay, but that is a question we want to know about. Region and radiation, so does that pain go anywhere else? So for example, if someone's having chest pain, does it radiate to their arm? We would ask questions like that. And then S and T, those are time and severity. So we just want to know when it started again, and then how on a scale of 1 to 10, where are they in the pain spectrum, okay? Medications, vitamins, if they're on CBD and THC, please let us know. All of that is important. I think sometimes people kind of feel like vitamins aren't really important. They can contraindicate other things. We need to know if there's different medications. We definitely need to know if they're taking any kind of gummies, if they are on a whole slew, a short list, a long list. We just need to know. Again, put it all on that quick form that Traci was talking about to kind of have it prepared and in your go bag. That way you could just hand it to us and we can go forward with that and make sure that we understand if we do have to give medication en route to the hospital, that we're prepared and we don't put something in their body that will contraindicate something they're already taking. Transportation and equipment. If your child requires specialized transportation and equipment, we need to know that as well. Okay, do we need to go upstairs to get the child down and they're not mobile and they need a stair chair? We need to know that so that way we can bring the stair chair and we can probably call in fire so that we can say, hey, we need more manpower so that we can actually help get this child down, this person down safely, so nobody gets hurt in this process of just getting them out of the emergency situation, and do it quickly because that's where we're at this point. And everything is going to happen very fast. We're going to get there very quickly, especially if it's a child. We're always going to try and get there quickly. But if we see anything that ever pops up with a kid, we're all running as fast as we can because we want to make sure that we can get there as quick as possible. Equipment, if they have specialized equipment that you know that you're going to need to take, again, Traci already touched on this, make sure that you have it, make sure you let us know. You can bring their equipment. There are certain situations where we're going to say, oh no, we need to use our stuff, but we can allow you, of course, to bring your things. Other transportation pieces, siblings can ride in the ambulance. It's not something that we ideally want to do, but we're not going to say, no, you have to leave your sibling at home alone, right? We would like, if they're in a car seat, we do want kids in a car seat. We want a 5-point harness on all of the kids. We have one in our captain's chair in the back, and then we have some stuff on a stretcher where we can strap on their chest, on their hips, and on their legs. If your child has a sensitivity to straps, we need to know stuff like that, okay? But we don't have as much space as we would like for all of the siblings and the family members. As a family member, as a parent, we need at least one person, 18 and older, that's going to be caring for that child to ride with us. The only time that we would not have that happen is if we're picking up a child from maybe like a school or a different environment. Maybe there's a child that's found wandering, something like that. But we always want a parent there. And that's for the child's benefit, for your benefit as the parent, and for us, okay? You guys are going to help ease the tension, ease that stress, make them less overstimulated, hopefully. You guys know what triggers them. You know how to help calm them down, and you know how to communicate with us in such a way that we can ease that stress for them. You can empower them, be their advocate, but you have to be there for that. Not to mention, we want you guys to know exactly what we're doing en route, okay? This is your child. You're their advocate. We need you guys there. And then connection points for us as providers. So Traci touched on this, like something that makes them feel comfortable. Absolutely. I carry bubbles in my pocket because when a child is stressed out, and if I can whip out some bubbles and blow them around and distract them, and then they start to laugh or giggle, it helps to decrease their stress level. And when a child is overstimulated, a parent is overstimulated, everyone in the back is stressed out, okay? If we can avoid a situation where a child's screaming and yelling and trying to rip things off, if possible, just by connecting first and making them feel more comfortable, absolutely, let's do it. We know it takes sometimes a little bit more time, but it really doesn't in the end if we can get ahead of that.
All right. So I'm going to talk about kind of the fireside response to this. I think Krystal stole all my words, so you're going to hear some repeat. But naturally, in the fire service, when you call 911, both a fire truck and an ambulance is going to get dispatched. And firefighters by nature want to beat the ambulance to a call, so there tends to be times we will get there first. I can't emphasize the need for, there's no such thing as oversharing with dispatch. When you contact 911, that person, that dispatcher that you're talking to, is typing everything that you're telling them. So the more information you provide to them, it's popping up on a screen where I'm sitting and any other fire officer is sitting up in the front on our MDT tablet. All that information that you're giving them is given to us so that we, so that we know what we're arriving to, what resources we need to do, or what resources we need to have when we get there. So, like Krystal said, the things such as, is the child located upstairs? Do we need a stair chair? Things like that. We can make sure that we have the proper equipment ready to go prior to us getting there. One of the big things I think everybody in here knows, a fire truck is just naturally loud, and we as firefighters are really proud of that. And so, again, if you guys can say to the dispatcher, hey, can you please let them know to kill the sirens before they pull up to our house, whether it's for sensitivity issues or, as we like to call them, the 2 a.m. dog walkers. We don't want to draw attention to you guys, and so if we need to kill the lights and sirens, we'll do so as safely as possible. Obviously, we have SOPs in place that make sure that we are, if we are traveling emergency response, that we do have to have lights and sirens up to a certain extent. But when we get into neighborhoods, we like to kill the sirens at least. But lights will probably stay on until we get in front of you guys' house. So again, you're making sure that you can provide dispatch with all that information so that we have it prior to our arrival. As far on the fire side, one of the biggest things, and both Traci and Krystal spoke on it, is prevention. Obviously, if there is a fire in your house or some sort of emergency in which you need to evacuate, such as, again, fire, smoke, anything that you deem you need to get out of the house, if you guys can have a plan and practice that plan with your family, we can't emphasize that enough, that, again, in a heightened stress situation, you tend to forget things. And practicing an escape plan or a meetup plan of all children in the home, making sure that everybody's all on the same page. Hey, if this is, one of the things that we like to talk about are if routes are cut off. Like if you know, hey, we can get out through the garage, or if we can get out the backyard or the front door, and one of those routes are compromised to go that way, have a backup. You cannot have too many plans to get out of your home, and if the need arises to where you need to get out. And then, again, you're talking about those practice plans with everybody. If you need to draw maps, that's one of the things that we share when we go to schools. We have kids try to draw maps of their house. Obviously, kids know their house very well, and if they are able to, have them draw it out so that they can create a plan. You guys let them create it if they're able, and if that's what, again, what works for you guys best, it'll get you guys there. If they're able to as well, the stop, drop, and roll method, or staying low out of smoke, if it comes to that, is one of the big things. And then motor vehicle accidents. That's something, obviously, that we respond to a significant number of. One of the things, again, kind of piggybacking off of what Krystal said, the more information we know when we get there. Obviously, motor vehicle accidents, there are so many people when we hop off the truck. We have pre-assigned duties each firefighter does when they hop off. So they know, hey, they need to do this, this person needs to do that. If you guys, understanding that you've just gotten in an accident, so you're probably not thinking a lot of these things, we are going to make contact. Like Krystal said, our first priority is usually children in those instances. So again, if we kind of know, if you can let us know, hey, that my child has sensitivities to this, or there's so much going on, it's going to overstimulate. We don't want to make the situation worse than it already is. And so if you guys can fill us in on that, obviously I don't think in most of those situations you're going to relay that information to dispatch just because of the situation at hand. But again, when we arrive on scene, we're going to ask these questions. And like Traci said, and something that we're going to start looking into is the QR codes to be able to scan and get information to be able to share with our other responding resources coming in. So again, if you can communicate that with us, it's going to help us a whole lot in making, again, that specific situation at hand go a lot smoother than what is hope. So.
All right, so now you have arrived at the hospital. Initially, what we're going to do is we're going to actually do a transfer report. We're going to actually go to triage, and we have to go through the ER. As the parent, we would definitely want you guys there because, again, we have a child who's under the age of 18. We need you guys there so that when we give the report to our nurse and our doctors or whoever's triaging at that time, you guys know your child. Y'all are the wealth of information, the expert. But we are going to do a quick rundown that's very short and bullet point to them. And hopefully you guys have those forms ready and we can just say, here you go. Here's a whole bunch of history about that child. But the main things that we're going to run through is where the child's coming from, their age, their sex, what the chief complaint is, any signs and symptoms, any interventions that we went through en route to the hospital, and whether they were hemodynamically stable with us, okay? So that's what we're going to give to them. We are not going to share every bit of history and all of the ins and outs of what's going on with them in the past, but if there is something that has happened similar to this in the past, we will definitely want to let that provider know so that they can pull it. Ideally, we would like to take your child to the destination you want us to take them, okay? That's not always ideal, though. Okay, so if your child is being treated in the med center, we would love to go there. But if it's a true emergent situation, we have certain standard operating procedures that don't allow us to go that route. We will have to take your child to the nearest appropriate setting and hospital, which would be Texas Children's for us, the West Campus. And so there's 3 hospitals in our area. One's primarily for trauma, one's primarily for medical, and then one is for children. We would have to go to those 3 hospitals. Depending on where you live, that may affect you. So please get familiar with where you live, your territories as far as hospitals in the area, because more often than not, the provider is going to have to take them to one of those unless it's not a true emergent situation, and then they have a little bit more flexibility. But it also depends on their standard operating procedures because every agency is going to be different. Be prepared that there may be some long wait times, especially during certain times of the year. If it's high flu season, things like that, there's going to be a longer wait time. If there's certain medications or feedings that you can do while you're waiting, if you have siblings that are coming along, just making sure that you prepare for all those things, you have something to do. It's bringing out the tablet time for the siblings. Like, we have to make sure that this is as low stress as possible for everyone involved. Because the reality is hospitals are scary and they're stressful for not just the kids that are going through the situation, but for the adults that are involved. Most all hospitals have child life specialists, and they're available, and they will definitely help ease the trauma in their interactions with children, especially during the interventions that the hospital provides. So you can ask for the child life specialist that's on currently. That makes them feel more safe, have less anxiety, and can just, again, decrease that stress level for the child. And so that's kind of our perspective of what we would go through when you first arrive to the hospital.
just on the child life note, if you have siblings with you, child life will also work with siblings, which I think is wonderful. Because I think that's super important to help with, as a primary care provider, I worry about the health of the entire family and the parents and the child and the dynamics. So we use child life very frequently. And then just when you get to go home. When you are given discharge instructions, read over those and make sure that what they say is also what they told you. I find often when I get discharge instructions back from a parent in the clinic, it may not exactly match up to what was said. And luckily, if we're in the same system, I can look and I can see everything that happened, and that's great. But if it happens in a system that I don't have access to, I don't have that opportunity. And sometimes discharge instructions will say discontinue a medication. Luckily, most of our parents are like, I'm not stopping that med. I know better than that. But if you have home nursing then follows those orders. So just kind of read over that paperwork. I say every time, parents, you are absolutely the expert on your child, and no one knows your child like you do. And so, be their advocate. If something doesn't look right to you, let them know, hey, I thought we did this, and make sure when you leave all of that documentation is accurate. The other important thing is just to know if there's any outstanding lab work, were there cultures drawn, were there different things that weren't completely resulted before you left the hospital that your provider or your primary care person needs to follow up on. Of course, if there's any medications, new medications, try to pick those up. I find in the last year, really since COVID, there's just been back orders on so many medications. I'm sure you guys have ran into that as well. Antibiotics, Tylenol, all of the things. So if you can pick them up as soon as you are able, that way if that pharmacy doesn't have it, we can find you a new one. And then just really it is important that after these, you follow up with your PCP just to kind of further continuity. And that is all we have.
Thank you so much. We have about 10 minutes if you would like to take some Q&A.
Sure, of course.
So after that telephone call, what Peg called and they called back, we asked them for their direct telephone number, which really gave us a lot of comfort. So as an MBIA community, I would really suggest that to all of us. That contact at the very end there is probably the most important thing you could do to have the quick response when we had a power failure at the house. So it actually tore the wires right off the house. The fire chief came to the house and said, I will sit outside. I can run this command from here. So he had the generator. He was ready to, run the lift to get a gym outside and stuff like that if anything had happened. It's really incredible to know these guys and have them know your situation so that they can come and do their job more easily and quickly.
And I just want to say one thing to that. With our patients, I do tell them to, and I don't know if y'all want this or not, but I tell them that they need to contact, especially when they move, like their local fire department, because we want them to know if there is a mandatory evacuation and emergency, we want them to know where those people that are going to need help are. So we routinely tell that. And then there's also, I know in the state of Texas, I'm assuming everywhere, certain forms you fill out with like the utility companies and things like that, that put you on a high priority for returning of services if there's ever power outages.
So also I'm going to add to that, obviously if you're from the Houston region, everybody got impacted by Hurricane Harvey. That was one of the points in which we started emphasizing with our community directly of pre-planning with our emergency dispatch. So for us, we get dispatched through Westcom. You guys can, they do have a number, and if I would have thought about it, we could have put it here. But finding your local dispatch and providing them with that information, such as, hey, my child has this, and that. That way it's automatically generated on our MDT. Like I said, we do have certain residents that we make frequently that, like for a fall call, typically it's only the ambulance, but we do have a couple of patients that we know off top we need the fire truck on that call, so it's automatically added. So again, if you're having that conversation, and when you move into new areas, find out who your dispatch center is, and they can pre-fill all that information in if you guys dial 911, and it'll be attached to your address. That way we can be ready for anything, and again, that stressful situation, that's less information you've got to share because it's already there and provided.
I have the mic, so I will thank you, because I did not have any idea that we could do that, so amazing. I want to hit on the QR code, because I have an obnoxious plan for my daughter that is brief where it needs to be, but maybe not so much in others, so thank you for that nudge. But I have been very hesitant to do the QR codes because I'm not sure how well adopted it is, and I don't want to assume that nothing will be there. So can you just talk a little bit more about, like, what are the mechanisms in place across of your groups that just can ensure those QR codes are actually utilized?
And I think that actually came up as we were working on this presentation, because you're right, everyone may not know about the QR code. So like I would say, if it was a car seat, if you had a sticker, I would do something around it bright red that says scan. You know, you want something that just draws your eye right to it. I would think too, if it was a medical alert type, I think pretty much we're trained to look for medical, because we're looking for allergies or epilepsy or autism on that medical alert bracelet. So again, if you had something there, that would probably, I would think, would draw our eye naturally to it. But I do think that it is still becoming more and more known. I learned about it actually from a patient who did it, and that's where I learned from it, and I love the idea. But I do think that's probably a valid concern. And so I think by working with your local, if you register with your local fire department, just let them know, we have this information too.
Just to add on to that piece there, when you have a notifier, like child's in the car, on the back of your car, everybody sees those when you're driving around, that helps us know that if there is a car accident that could be truly egregious, that there was a car seat, or that helps us know, look for a car seat. Okay, so you could put something in your car that says, scan this in medical emergency for my child. Like, just tape it inside your car in a way that's safe, that makes you guys feel comfortable. Or even say to dispatch when you're on that line, tell the first responders to scan this QR code. Okay, something like that to tell us, hey, this is available for you, look for that. That way we can recognize this. I've seen some where you can put straps that say something about that child. I always have reservations about adding or changing anything to a car seat personally, but you can always check in with your local department if you would like to do something like that.
Where can you find the informational emergency form that you showed us before?
So that one, it is available online. I usually, honestly, I have many copies of it, but I just look up, if you look up American Academy of Pediatrics, emergency information form, it should pull up for you.
Yeah, I just wanted to point out that the QR code, that's one of the silver linings of COVID, right, is that we've all gotten used to those with menus and stuff. So I think they're a lot more adopted than they used to be, and all the camera apps on iPhones will pick up a QR code. But that is just a side note. What I wanted to say is, for those who were taking notes, on the last screen where it said the discharge instructions, you mentioned note about making sure that your printed discharge instructions match what you were told. The one thing I wanted to point out, because this has been a problem with us leaving the emergency room, is also writing down the last time that they were given the medications that they're using, because that's something that we run into. We go and fill the medications, and then we're like, do we start these right away? Did they get them when we left? Have they even had them yet? And then it's really hard to call somebody and figure that out. So yeah, just wanted to say that.
Any other questions?
So I just wondered if you could mention too about the ICE on the telephone, on the cell phone, so that, and then, so then mom is the caregiver, and she's, you know, number 1, ICE 1, and then Peggy Wickert, and then ICE 2 in case of emergency. Can you talk about that?
You want that one, Joe?
So I guess just to make sure, so you're asking about who should be contacted first, or? Okay. Okay. I get what you're saying. Okay. So typically, while yes, that's a fairly well adopted thing, I actually have it in my phone as well. We don't usually make it our business to go through folks' phone. Also, especially depending on the situation, most people have their phones locked unless you have the biometric of fingerprint or eye. We don't have a way to access that, and again, depending on the patient's state, we might not be able to gain access to the phone, and for the sake of not screwing it up for that person and locking them out of their phone when they do finally get out of the hospital, we usually don't go through the phone. Again, depending on the patient's conditions, we will talk to them and say, hey, we can make a phone call. Once we get you stabilized and in the ambulance, we can help with that. But typically, first arriving, I hate to say it like this, but the least of our concern is looking in the phone. It's making sure the patients are all stable and taken care of and kind of transported from there.
I do think if you end up like in the hospital, hospitalized, it would probably become a bigger thing, because once you're stable and you're there, if you're still not quite alert, then they will start trying different avenues to find anybody they can. So I think then it's probably more pertinent.
And when we get to the hospital and we give that report, we will let the triage nurse or the person that's taking our report know mom is here with them if for some reason they have to step out and go to registration. Usually as a provider, I will actually go to registration and my partner will stay with the patient, so that way there's always someone there with the patient, and then I'm helping to like guide mom or dad or whoever is with the child. But we're going to let them know this person's in the waiting room, this person's here, this person's on their way, and I will actually ask for information of someone that I can follow up with. So if someone says, can you call me, like a mom's at the house and she's taking care of siblings, and dad's taking the child to the ER, I'll actually follow up if they ask me to. I'm happy to do that as a provider. Not all providers necessarily will do that, but I'm more than willing to make sure I can ease as much stress and trauma for the family as possible, and kind of just communicate and be a bridge for everyone.
Thank you so much. Let's give a hand to our Houston first responders. Thank you.
Okay, everyone, we're going to be having lunch, and it's being set up right now. There's 2 buffet lines right outside the ballroom doors, and you can have 4 lines, 1 on each side, but we're going to have to come back into this room to bring your plate. So while we're out there getting our lunch, they're going to have waiters come in here, and they're going to set the tables with silverware and water and tea. So if you have anything and you're going to come back to the same place, put it on your seat so that they have room to put everything on the table. And if it gets really crowded and you can't find any space, I told them we might utilize Ballroom A. It has a classroom set up, so you could sit there and eat. But try and find in here first. Thank you. And we'll be doing our raffle about right at 1 o'clock before we go to the next session. So make sure you find some time to put raffle tickets for Friday. So I think next time she